So if you or someone you know has been prescribed Solian or Amisulpride, then this video is very important because we're going to talk about everything I think you should know. Let's get into it. So Solian or Amisulpride is often used for schizophrenia or other psychotic illnesses, and sometimes is used in conjunction with other medications to treat these things. It can also be used at lower doses for persistent depressive disorders, but that's more rare. In terms of how it works, we don't fully understand it, and so I'll be using the word theoretically a lot, but theoretically, like all antipsychotic medications, it works by working on the dopamine receptors. Now, interestingly, at low doses, Amisulpride affects different receptors to the receptors it affects at higher doses. So the thinking is that at low doses it affects presynaptic dopamine receptors, and at high doses it affects postsynaptic dopamine receptors. The result is essentially, though, that if you're lowering dopamine, you can reduce the positive symptoms of psychotic illness. And the positive symptoms of psychotic illnesses are things like hallucinations, paranoia, and delusions, and those kinds of things. Usually you can have these effects, within a week you might start seeing changes, but with, a lot of other antipsychotic medications, it can take 4 weeks or 6 weeks before you really see the maximum kind of response. It's important to remember that psychotic illness is very difficult to treat, and this probably won't remove, it's not a magic pill that just gets rid of every single symptom that you might be suffering from. If you have a psychotic illness, it can usually reduce the intensity of symptoms by a third, roughly. There is a small subset of patients called super responders that can have a significant reduction in symptoms of schizophrenia, and they can even gain employment and have really high levels of functioning. But otherwise, most people just get a modest but significant reduction in symptoms. If you do find you get improvement in symptoms with Amisulpride, then you should continue it, and at least for a year after your first psychotic episode, but arguably for life. You have to make this decision with your doctor, right? Whether you want to take the risk of stopping an antipsychotic medication, because the risks are huge. To have a psychotic event is very high risk. And so if you are to do that, you have to work very closely with your doctors. And if you're going to stop your antipsychotic medication, they need to know. You need to tell them. You're not going to get in trouble. You're not going to be punished. They just need to be aware of what you're taking and know what works and what doesn't work. And if the side effects are intolerable, then they need to work with you to find a better medication. But if you find that you had psychosis, then you took Solian for a year, then you stopped it and psychosis came back, then you probably need it lifelong, unfortunately. And I'm not going to beat around the bush. The side effects are absolutely significant, but you need to compare the side effects of taking the medication to the effects of not taking the medications. And it's worth the side effects of the medication to not go through another psychotic episode, right? Now, if you don't find any benefit from it, if it isn't working, then don't stress. There are lots of other atypical antipsychotics you can try, and because of the way that they work, the atypical antipsychotics, the fact that they all kind of cover different receptors, just because one doesn't work doesn't really mean the next one won't work. And you can have a very good response to one and not another. So it's worth trying another one. And if you find that after 2 trials of antipsychotics you're still not getting a response, then you can talk to your doctor about considering clozapine. And clozapine has a very good efficacy, a very good effectiveness to reduce psychotic symptoms, but it just has a lot more monitoring because the side effects can be much more serious than other antipsychotic medications. Now, antipsychotics affect the dopamine pathways in the brain and have side effects associated with that. And a common side effect to all antipsychotics, the old ones and the new ones, but mostly the new ones, is metabolic syndrome. And what do I mean by that? I mean weight gain, okay? It isn't good for your weight to take an antipsychotic. Okay, people put on weight when they take antipsychotics, and so it can be avoided if you are extremely conscious of it and put a lot of really hard work in preventing weight gain. And that is, you follow the simple rules here. You exercise every single day. You eat healthy, even though you will want the greasy food from time to time. You've got to really minimize it and go for the Mediterranean diet. Lots of veg, okay? Lots of fish. And you've got to also sleep well. You know, make sure that your circadian rhythm is in check, which means you're going to bed at a regular time, you're waking up at a regular time, you're hitting those 8 hours, and you're not on your phone at night and that kind of thing. You need to take care of your physical health if you're taking these medications. You and your doctor have to monitor, you know, your BMI, your weight, your waist circumference, and all these things. But if you're motivated and conscious and monitoring closely, you should be all right. The problem is, though, with a lot of these psychotic illnesses, motivation gets affected by it. And so that's a massive challenge, and it's handled on a case-by-case basis. But I don't have any solution to motivate people who have an illness that affects their motivation. That's just a really difficult problem. The other side effects, other than the kind of weight gain things, are movement side effects, and these can be things like akathisia, where you just feel like you can't stay still, you're always moving. It can be dystonia, where muscles cramp up and hold, which can be extremely painful and can even cause, you know, problems with the airways. And the worst is tardive dyskinesia, where you have involuntary movements of the muscles, and that's bad because it's essentially irreversible. So you have to, if you're getting any kind of motor symptoms, make sure you're talking to your doctor about these symptoms so that they can try and assess which one it is. Is it an irreversible one or a reversible one? And then if it's one of the reversible ones, there are medications you can take to help with them and reduce them, and that's okay. But if it's the irreversible one, you might need to change medicines. So, you know, just having a good relationship with your doctor is key here. So we've talked about how you have movement side effects, weight gain side effects. These are also medicines that cause sedation. They block dopamine in the brain, so it also affects the pituitary gland's ability to inhibit prolactin release, which means you get high prolactin levels, especially with Amisulpride, the Solian medication. These high levels of prolactin has significant effects, especially on females, to be honest. Like it affects puberty and development, and you know, it can inhibit periods, so you get amenorrhea or lack of periods, and you can get galactorrhea, so milk letdown from the nipples, and that can be, you know, that can affect your confidence if it happens in the middle of the street or something. So if you're getting any of these symptoms, you need to check with your GP or your doctor and get blood tests to measure your prolactin levels, and then you can work with your doctor to manage the situation. So some key advantages with Amisulpride is that although weight gain is a side effect that we talked about, it's less associated with weight gain than probably the other antipsychotics, the atypical antipsychotics, which is great. So that's a positive thing. And also at low doses, it can have different effects to high doses. And so you might find certain symptoms get better at low doses, which have less side effects. And that could be a really good thing for certain people in certain situations. The issue is, though, that it's normally a medicine you take twice a day, and remembering to take a pill twice a day can be challenging for some people, especially if you have chaotic lifestyle. So it can be challenging to be compliant with twice daily dosing. And you would want to avoid it in people who shouldn't have high prolactin levels. So this is people like teenage women, postmenopausal women, or pregnant women, or nursing, but even if they're breastfeeding, you probably want to avoid it as well. This is a medicine that has been shown to have good efficacy with people who have prominent negative symptoms in schizophrenia, which is great. So the negative symptoms, by the way, are things like social withdrawal, lack of content of thought, and things like poor motivation. The other thing is that it works well as an augmenting medicine, as I said, so you can use it with other antipsychotics, so you can team it up with like clozapine. So if you've tried 2 antipsychotics, they didn't work, so you've tried clozapine and it's not working that well, then you can team it up with Solian or Amisulpride together to have a good effect. But you have to work with your psychiatrist to decide what the right regime is for you. Alright guys, that is it. That's all I wanted to share in this week's video. If you enjoyed this kind of content, please consider supporting the channel just by leaving the video a like and subscribing to the channel. Share it with your friends, do all that good stuff to help us YouTubers out. And I wish you all just an absolutely wonderful day. It's actually quite late for me, so I'm going to head to bed soon, and I'll see you all in the next video. Bye for now.